Hey folks, I'm Howard Lux.
I'm Jeff Berg.
We are the Two Boneheads, two orthopedists with a wealth of experience and too many years in doing this together, and we thought we'd share it with you. Today we're going to talk about tennis elbow. It's a very, very common problem. Some would say everyone's going to get it. If you're lucky enough to live beyond 40, you're going to get it. What is tennis elbow, Jeff?
Well, there's some misunderstandings, I think, of tennis elbow. By the name of it is tendonitis, lateral epicondylitis, which implies a tendonitis, which is an inflammation. I think there's some inflammation associated, but the primary problem is degeneration of the tendon at the side of our elbow, the tendons that are responsible for moving our wrist up and down when they're facing the floor. And you get little microscopic tearing and degeneration, and all that causes pain. And there is some associated inflammation, as there is with most problems that we have.
Now, so I find it really interesting because tendinosis is the root of most of our tendon problems. It's the reason why you have Achilles tendonitis, or rotator cuff problems, patella tendonitis, and tennis elbow. It's this age or activity-related degeneration of the tendon. Now, if we go ahead and MRI, both of us don't have elbow pain. If we MRI both of our elbows, probably 3 of the 4 MRIs would show tendinosis. So why does one person have pain with tendinosis, yet someone doesn't?
I don't know.
Right.
I don't know that we know really
Maybe
well.
An overuse activity issue. Oftentimes we'll see people, they decided to sand and paint their living room one weekend or rake leaves. But it's not uncommon for you to wake up one day and the side of your elbow hurts. So what do you do for that 50-something? They're right-handed, and they're coming in and the lateral or the outer side of the elbow hurts.
I think the key with this problem is, so the first thing I tell people is, just like you alluded to, this is a problem of middle age. And this tends to go away in almost everybody. I'd probably say somewhere in the order of 85, 90% of people if you give it enough time. And so the whole thing for me, the way I treat this, is really to try to buy some time. And that's the challenge, because in this day and age, most people want to be done with their problem within a week or a day or an hour. And this can take months and months till it's better. And some patients can't buy the time. They can't work or enjoy the quality of life. And sometimes we do surgery on patients. But for the most part, my treatment is mostly buying time. So what I try to do is several things. One is I try to prevent them from making it worse. So I guide them on activities to do and not to do. Number 2 is I'll try to get them to reduce some of the pain, some associated inflammation if there happens to be some swelling. And different people argue about how you should do this, but I use things, whatever I think may be the problem. Typical things for me will be massage. Sometimes I'll use some ice. Sometimes I'll use some pain medicines or anti-inflammatories. And a little controversial, I find that a steroid injection, although I will be sure to tell the patient it is not treating the problem, it won't cure the problem, it won't heal the problem, but it can be a very good way, if used judiciously, to get rid of your pain. And sometimes that buys us enough time for this to heal.
Sometimes it makes it worse.
Yeah, I haven't seen a lot of that, but you're right. I mean, that's written in the literature. But, a lot of things we do sometimes make things worse. So I think everything is sort of, risk and benefit analysis. And you get them and I get them. There are patients that just can't function. It hurts that.
There are some of those that are absolutely miserable, and they come in and they've had 6 injections.
Yeah, I'm not I will not, I rarely do more than 1. I'll sometimes do 2. I shouldn't say never, but if somebody came back to me, I've had patients who just can't have surgery and they can't function. I may give a 3rd, but you're right. I do see patients who have 6 and 7. And the thing you worry about, at least for me, is that steroid and perhaps even the lidocaine that we use, that cortisone mix, can degenerate local tissues. And there are ligaments over there. And if you degenerate those ligaments, you took a small problem and you just made a very big one. Yeah.
So these
the final part of my treatment, though, Howard, one of the things I think is most important, and the patients kind of blow it off, is when they start to feel better. I think that's the time where you really have to get the elbow better. I think a big part of what happens here is like a lot of these tendinopathies, they're overuse problems.
Right.
And you're asking the tendons to do more than they're capable of doing. And we don't always know what the problem is. I don't know if they're not strong enough, they're not flexible enough, they don't have good enough endurance. I don't really know what it is. But I think what tends to happen is the patient feels better, but the problem still exists. They still have that deficiency. And so I'll use therapy to try to fix that. I kind of liken it to, I can get the patient to feel better, but if we don't fix that, it's sort of like if your tire goes bald because it's out of alignment, getting them to feel better is like changing the tire. And if we don't fix the alignment, it just wears out the next tire. So I think therapy, once you're feeling better, is very, very important before you head back into all your activities.
Agreed. And another thing that I try to drum into people is the first day you feel better is not the day you head back outside.
Absolutely. But inevitably it is.
Of course.
Yeah.
It's going to bring you right back into the office really shortly.
Yeah. I mean, I'll see that a lot. You know, I'll see patients who we get to feel better, whether it's using some medication, ice, massage, injection, whatever it is. We can get them over the pain. They feel good, so they go back to their activity. They haven't rehabilitated it. They haven't corrected the underlying problem.
Right.
And they go back, rake some leaves or whatever, and boom, they're back.
Now, I tend not to MRI these elbows quite often because we know it's going to show. We know it's going to show evidence of tendinosis. We know it might show some fraying or some tearing. What are your thoughts? When do you MRI them?
I never get an MRI if I'm pretty sure this is lateral epicondylitis tennis elbow. I never get an MRI. It's really a waste of time and money. And like you said, they almost always show tearing of that tendon, and that gets the patient just a little upset and nervous. And you have to kind of talk to them and tell them, listen, these all show that. This is just degeneration. And if that tendon tore, you'd actually probably feel better. Because when we operate, that's what we basically do. So I don't worry about that. I try to discourage that. Now, patients will come to me with MRIs, and I'll explain it to them, but I don't really think it's a good use of a person's time or money.
I agree. So tennis elbow is very common. If you have pain on the outer side of your elbow when you lift an object with your palm facing down or your forearm in a pronated position and it hurts on that lateral side, you have tennis elbow. It's a really stupid name because most tennis players don't get tennis elbow. Those who have tennis elbow don't typically play tennis. But it is an age-related or activity-related degeneration. It's going to get better in the vast majority of you if you wait. I think judicious use of a corticosteroid injection, in patients who are in absolute misery might be appropriate, but then we get into this whole pain talk and why your pain is severe to begin with. Surgery is rarely indicated, but every year you manage to find a few who might benefit if the symptoms are there for more than 8 to 10 months and they're just tired of it. Anything to add to that?
Yeah, I mean, I think the only thing that I would say is that there is another time that I see tennis elbow. And I'm not sure that the path is a whole lot different, but I think you can get degeneration of the tendon because it's older. And then patients can get this problem even with their everyday activities.
Right.
Or you can have an acute degeneration of the tendon by some sort of injury. So it's not uncommon somebody walks through a doorway and smacks the side of their elbow against something. I think that tendon now gets damaged. And then just simple activities will aggravate that.
Right.
And so I think that's another case. But like you said, pain on the outside of the elbow, particularly with your palm down, lifting things like jugs of milk out of the refrigerator is a common one people complain about, is probably tennis elbow. And if you wait long enough, it's probably getting better.
Agreed. We hope you have a great day. Take care. Bye.